we touched briefly on the issue of emotional health. And so tell me your thoughts on that in general. What are your recommendations in Outlive, in your book, and how do you associate the issue of psychological and emotional health with with exercise and diet, for example, or any of the other lifestyle modification processes that we've discussed?
So I think emotional health ties into this longevity equation in many ways. So you can start at a very extreme end. A low enough state of emotional health can be a direct threat to your life. So again, the most extreme example of that would be suicide. But if you walk back from suicide, we talk about parasuicide. We talk about all the different behaviors that people engage in that are slow suicides. I can't speak to what the statistics are in Canada, but in the United States, and I suspect you know these more than I do, Jordan, if we look at 3 categories of deaths of despair: suicide, overdose, and alcohol-related death, so cirrhosis, things like that. The deaths of despair have been increasing at anywhere from 10 to 20% year on year over the past 4 or 5 years. So that's brutal. Yeah. So just last year was the first year that overdose took more than 100,000 lives in the United States. So
yeah, well, it's an open question. How many people on the edge of depressive collapse were tipped over that edge by the lockdowns and the prolonged social isolation and the increase in fear? Up in Toronto, I still see people, and in LA too, it was quite noticeable. I was there yesterday. I still see people cowering behind their masks. And, you have to have been made pretty chronically afraid to still be doing that. And the cost to people's health of the fear campaign that drove the lockdowns, we're going to see that. I mean, I don't know how that's contributing to the excess death statistics.
I think it would be very difficult to say that those statistics I rattled off aren't impacted by COVID. So what's going to be interesting is to see how that plays out going forward. My point, of course, is that these deaths of despair are a very extreme example of how emotional health impacts longevity directly, right? Here, it's just truncating lifespan way too soon. In fact, overdose is now the leading cause of death in the United States for people aged 10 to 55.
Wow. Oh, that's terrible.
So
what do you see on the prevention front there? Or do you have?
Well, let's go even one layer further, because I'm sure there's someone listening to this who says, well, look, that's not me. I don't drink to excess. I would never touch an illicit drug, and I'm in no danger of killing myself. So that means emotional health is checked. And I would say, no, not really, because that's just the first layer. Let's go one layer deeper. I think the next layer is how many people, because of their relationship with themselves, are unable to self-care. If we're really going to be honest about it, how often do we engage in not what would rise to the level of quote unquote harmful behavior, but certainly things that are not in our best care? Eating a little bit too much, not exercising enough, not sleeping well, engaging in behaviors or failing to engage in healthy behaviors. Now, I see this constantly with patients where it's not that they don't know what to do. It's not that they don't know that they should exercise, but if you really push them, they have a negative relationship with themselves that is preventing them from taking care of themselves. And I would say that the impact on length of life there and quality of life is much bigger than the deaths of despair, but it's much harder to quantify. So then I'd go even one step further and say, okay, well, you're not in category 1 where you're an immediate threat to your life because of this your emotional health. And you're not even at the point where you're failing to take care of yourself. But now you maybe land where you're just not happy. Your relationships suck, right? You're a lousy father. You're a lousy husband. You're a lousy parent. Any of these things. And you're basically living without a sense of why, right? You're not, as Esther Perel put it to me, what is the purpose of living longer if you're unhappy? And I think that that's probably the biggest circle. And that's, to me, one of the most interesting ones here. And again, for me personally, the one I wanted to explore the most in myself, which was how much of this obsession with longevity is about figuring out how to not die versus understanding how to live.
Mm-hmm. And so what have you concluded on the treatment front in regards to that set of problems, or the prevention front, let's say?
Well, again, it's worth caveating that everything that I write about in the book, I come to it with some lens of expertise, right? I mean, it's what I do for a living. It's what I've spent more than a decade researching. I can speak with some authority about cancer and heart disease and dementia and exercise and nutrition. When it comes to this particular issue, I have no expertise. I come at this through the lens of a patient. And therefore, I think everything I say must be taken with the understanding that it's somewhat anecdotal, and therefore needs to be explored with professionals who I think can bring to it, for example, the expertise you could bring to it. But I'll tell you what I've learned. I've learned that most people probably have some degree of unresolved business in their childhood that has produced adaptations. And in some cases, many of those adaptations are very good and should continue, but some of those adaptations are negative. And that is malleable, right? So there's kind of this view of hope, which is you don't have to throw out the baby with the bathwater. You can, again, in my case, you can take some of those adaptations, which produced, hard work, discipline, all of these things, but you can get rid of some of the negative ones, such as the negative self-talk, the perfectionism, all of these other things that created a very negative impact on myself and those around me. So this requires very hard work. And unfortunately, it's not something that lends itself to the faint of heart. Unfortunately, at least in my experience, I'd be much more curious at your experience. Many people need to be at a local minima, not necessarily the rock bottom, but close to a rock bottom to start to probe those things.
Well, I can tell you some of the things that I've learned, partly as a consequence of public lecturing and speaking to people constantly about how they might straighten up their life. The first thing I would say is we've run a series of studies on a set of programs I designed with my students and my previous graduates, my graduate supervisor, Robert Peel and Daniel Higgins. Peel was my supervisor and Higgins my student. We developed a suite of exercises called the Self-Authoring Suite. They're at selfauthoring.com. And the past authoring program helps you write an autobiography and clear up that excess baggage. And the present authoring program helps you analyze your faults and your virtues rather programmatically so that you can start to generate a strategy to rectify your faults and to capitalize on your virtues. And the future authoring program, which we've studied most intently, helps you develop a vision for the next 5 years. And if we have people do the future authoring program before they enter university, if they do 90 minutes of developing a vision, 90 minutes, that's all. No preparation, with no one reviewing what they've written, the probability that they'll drop out falls 50% and their grade point average goes up 35%. And it is tied to precisely what you described, is that people need a reason to live. And I also, in this exercise, we help people break down the reasons to live. And this touches on another point that you made regarding relationships. You can't be healthy psychologically in the absence of a network of functional relationships. You need a partner, you need a family, you need friends, you need business colleagues. You have to be nested in a functional social hierarchy. And so we walk people through this process of vision development. We ask them what they would like to have in 5 years if they could have what they wanted and needed. We ask them how catastrophic their lives would be in 5 years if they let their bad habits get out of control. That sort of sets the parameters, right? Don't do this and do this. And then we ask them 7 questions. What do you want in an intimate relationship? What do you want in your friendships? What do you want for your job and your career? How are you going to educate yourself? How are you going to take care of yourself mentally and physically? What are you going to do with your time outside of work that's productive and generous? How are you going to shoulder some civic responsibility? I think that covers the fundamental domains. Those are places that people generally find meaning in their lives. And the upshot of all this is that almost no one has an explicit strategy for their life, and that's a catastrophe. What do they say? The people perish without a vision. This is literally the case, and this is precisely what we're talking about. But it turns out, just as in the case of exercise, you said you can get a walloping advantage from just going from 0 to 3 hours. Going from no plan at all to a hastily contrived 90-minute plan, well, like I said, that stops half the kids from dropping out of university. And so there's a large body of research showing that these sort of writing exercises to clean up your past and to structure your future are salutary on the psychological and the physiological front. So you can imagine there's a three-pronged approach to Healthspan, right? Sufficient exercise, appropriate diet, and the development of something like a comprehensive account of and vision for your life. Now, and that would be relatively inexpensive and, all things considered, relatively easy to implement. So you never know, maybe we'll get smart enough to move hard in that direction as a society over the next couple of decades.